The Nevada Minority Health and Equity Coalition Public Policy Workgroup presents Advocacy and Policy Change. Thank you for joining us for another in our advocacy series. I'm Tom McCoy, Executive Director of the Nevada Chronic Care Collaborative and co-chair of the NMHEC Public Policy Workgroup. Joining me is Carissa Pearce from Children's Advocacy Alliance. Carissa, the obvious question, since advocacy is in your organization's name, advocacy's that's what you're all about.
Yeah, absolutely. Good morning, Tom. It's nice to see you. Yeah, so advocacy is in our name, so that's very important to us. We have an actual mission statement that I can share, and then I can kind of go through different parts of it because advocacy is so broad that it's like, well, what are you really doing within that? So our mission statement is the Children's Advocacy Alliance is an independent voice for Nevada children, advancing systemic change in the areas of early childhood education, children's health, and child welfare. We achieve public policy wins through collaborative and collective impact within the community to ensure every child in Nevada thrives. So, yeah, Tom.
No, I'm just going to say that makes it much clearer for me. But for our viewers, the word alliance suggests that you work with other organizations throughout the state. So who are some of your partners that you work with?
Some of our partners, we work with the Children's Cabinet. We work with the American Academy of Pediatrics, the Nevada chapter. Of course, we work with the Nevada Minority Health and Equity Coalition, and UNLV has a lot of different organizations within that we work in or work with as well, including the NICRP. They do research and policy as well. And then we honestly try to work with any organization that also looks into children's health and well-being. We have a few organizations related to foster youth, so foster kinship. We work with Make It Work Nevada, Make the Road Nevada. So a lot of different organizations across the state.
So in terms of policy change, issues that impact children in our state, who makes the decision on what's going to be supported legislatively or at the local level, federal level, state level?
That is a decision that is really collaborative across our entire organization. So we are a relatively small organization of about 8 to 10 people working internally, but we also have a really amazing board. And so our board sets our initial agenda. That is who determines that our 3 main pillars of focus are going to be child and maternal health, early childhood education, and child welfare. So within those 3 pillars, that's where we're able to get really granular. So every year we reevaluate which populations are we looking to connect with or to create change for. And so our main population is children. And then within that, we really look at children or even maternal care from the prenatal period to 5 years old. So we do less policy for older children unless it's something that we're supporting. And then because they're still children, we have a lot more room to support that. So it really becomes a granular discussion within our organization of within each of our pillars, which population are we going to focus on? Who's already involved in this space? If there's people already involved, then that often helps shape the way that we'll engage either with that group or in a way that we're trying to make our own voice in that space. And then we really look at the scale. So most of our policy is done at a very large scale. We try to make systemic change for all children in Nevada. And sometimes it will have target populations, like we'll target children with disabilities in a specific area within that population or an issue that we've seen that could be improved through policy or with our universal pre-K, that is also a specific population of about 3 years old to 5 years old. And so we're able to get really granular with our issues, but it really comes down to our research as policy leads. So I'm our health policy manager, so I lead in our health space. And then we have just a lot of internal conversations about what issues are happening. And then we also bring that into our population and our community, and we talk about what issues are happening there. And so that kind of guides whether we're going to decide to lead on the legislative efforts or support legislative efforts. And we're able to do a lot more supporting in a lot of ways than what we typically have capacity for in the meeting. We try to do a little bit of both.
So let's say that you're going to be supporting a particular issue in 2025.
Mm-hmm.
How do you go about reaching out to legislators once we know for certain who's going to make up the legislative slate after the election? But how do you reach out? Is emails, personal visits, all of the above?
All of the above, honestly. We
And
try to
more.
reach, yeah, we reach legislators in as many ways as we can. So Children's Advocacy Alliance is a 501c3 nonprofit organization. And so we have certain regulations that we follow to comply with being a 501c3, working in a legislative advocacy and lobbying capacity. So lobbying is a very specific type of advocacy, but that's really where you get into the conversations directly with legislators. And so to be aware of what our regulations are, we have our own trainings and whatnot. And then we actually have one person who's our government affairs manager, and he is fabulous. He has a lot of connections with legislators that were just formed over time. I think having just conversation with our legislators is really important to begin creating relationships with them so that you can come to them and say, hey, I have this idea, or hey, we noticed this is happening. Can we have a conversation and see what you think about this? So it really also depends on the legislator. Sometimes they like to just have a quick phone call or a quick text. Sometimes you're sending more formal emails so that other people can be included as well. And then sometimes you're going and trying to talk with them in person. And that can really have the most impact, especially if you have not met with a legislator before and you want to start some type of dialogue with them. Meeting them in person is one of the best ways to do that.
So Children's Advocacy Alliance gets involved with Children's Week, doesn't it, at the legislature?
Yeah.
Isn't that a really great opportunity to interact with our legislatures?
Yes, Children's Week is a really great way to interact with so many different voices that are a part of legislation. So the legislators will be there walking around, or they're at least in the building in their offices. And so a lot of times, if you don't have the opportunity always to go to Carson City and to be in the legislative building, but you're able to come for Children's Week, then that's a really great opportunity because the legislators want to be there and they want to hear what we have to say. And so they're open to setting up meetings during that time. And then you're also able to meet a lot of different community partners. And so you can really do some networking with other organizations who have similar interests in the topics or issues that you're focused on. So you can go and reach out to them and then start to form some new relationships in that way. And then I love Children's Week too, because one thing we've tried to do in previous years and we're hoping for this year is that we try to schedule hearings. We ask for the committees to schedule hearings about children during Children's Week. So if there's a particular issue related to health, for example, we would ask for the Health and Human Services Committee to have a hearing around that bill. And then anyone who's interested can go and listen in and be involved. And that's one of my favorite ways to engage with the legislative session as well, is actually listening to a hearing and seeing what that process is like. And then you can start to understand what your role is and how you can be a part of doing something bigger and contributing to the conversation, or by giving testimony about your experience, or finding other like-minded people, or even finding opposition in the room and trying to reach out to the opposition and have a conversation with them about where they're coming from, of why this might not be the approach that they think is going to be most beneficial. And so there's just a lot of room for dialogue and making connections.
Does the Alliance have a grassroots group and a network of sorts that you can ask to help push legislation?
Yes, I wouldn't say we necessarily have just one group. I think within each of our topics, we really try to pull together all the different voices of people who either would be impacted, such as providers, or people like childcare providers as well. We want to hear all of those voices and bring them in to be part of conversation. And so we have different groups, but we do have a lot of different networks. So when something does come up, we reach out to those networks who say, hey, there's a hearing happening. We think that you might like to be involved, share your voice in this way or that. And then through that, we're able to continue building awareness around the issues, and especially around the bills that are popping up that might not, people might not realize are coming up right in that moment.
Well, the obvious question, and this is maybe you haven't reached that point yet, but can you share some possible legislation that you're going to be looking at in 2025?
Yeah, absolutely. So at this point, we do have a more solid agenda for things that we are going to be leading on. And so we're really excited. We have within our 3 pillars, I'll talk about health first. So our lists have gotten a little bit more juicy than what they had been back in like the summer even of 2024, because at this point we're really getting ready, gearing up, figured out what our issues are that we're taking. And so it's exciting to see that process first, just to see how policy gets created in the interim from the beginning of our last session to now. And so now at this point, we're pretty well off on what we're bringing to session ourselves. So I'll get into it briefly. For health, we're really focusing on children's mental and behavioral health initiatives. So we have a few policy initiatives that have already been put in as BDRs by the Joint Interim Health and Human Services Committee, and we're really excited for that as well. So those 2 are creating an office of children's mental and behavioral health. So this is exciting because it would be a statewide cohesive office where decisions about children's mental and behavioral health can be made. Or we have a lot of different consortia and groups that are spread out across the state. And what we would like to see is a unified voice where all of those consortia can talk to that person, or that person is really focused on the higher level. How can we do things across the state for better mental health outcomes? Another one we have, oh yeah.
No, just on that point, I think would be helpful to our viewers. One of the challenges when you create something like a new office or some type of study is a fiscal impact. Fiscal note might be attached to that legislation.
Mm-hmm.
That can be a problem in terms of getting support from legislators. How do you see that working out for you?
So yeah, fiscal impact is always the biggest challenge of getting a policy or a bill passed through legislation. And what we really focus on in our strategy, anytime we have a fiscal impact, is demonstrating how the benefits will outweigh the cost, and then how it will start to become a better system of care overall. So a lot of our policies also focus on preventive care, or some type of preventive measure that would lessen the amount of care that is needed reactively. So by focusing on preventive things, the cost up front might be more expensive, but what that does is it reduces the cost of the long-term effects of not receiving a certain type of care. So that's actually one of our strategies for mandating insurance coverage for screenings for developmental disorders of childhood. So that's another one of our priorities. And what that does is that in those really early years, typically from like infancy to 3 years old, we do developmental disorder screenings. And then having treatment within that early period of time when the child's mind is really like a sponge and really developing, you're able to put them back onto a track to have a strong development. And then in their later years, when they even hit 5, 6, or 7, they no longer have that developmental disorder. They were able to catch up, so to speak, with their development. And so then it costs less to care for that child for the rest of their life. So that's a really big strategy, is really just demonstrating how the cost will outweigh the benefits will outweigh the cost.
So what other policy issue?
So still in the mental and behavioral health realm, we're working on some initiatives that would create higher education programs, including a bachelor level program and a graduate level micro-credential that both really focus on children's mental and behavioral health, and then specific roles that they could do within that. So this one is one area that we're really getting granular and focusing on what is like scope of practice. And this one, we're bringing in so many different voices, including voices from all of our higher education schools, so that we have a really strong program that we're bringing forward. And then we're also, for just health overall, we're looking into ways we can expand Medicaid coverage to provide prenatal health care for all Nevadans. And then just doing things like supporting physical health and nutrition. So we'll be not leading in this space, but definitely supporting universal school meals, which was a bill that was brought in the previous session. And so that one will be coming back again, and we're excited to see that.
Well, it sounds like you've got a busy next several months ahead of you, and we wish you well in your efforts on behalf of the Children's Advocacy Alliance. Thanks, Carissa.
Yeah, thank
There
you
are
so
5 videos in this series. We encourage you to tune in and hear the perspectives of other public policy work group members on another advocacy and policy change. Thank you.
Thank you, Tom. If I can
Thank
just
you.
add, we have on our website, we'll be tracking a lot of bills, and we'll be showing all the things that we're prioritizing, or just things that touch children and families. So if you want to be engaged or see what's happening during the session, you can always look at that. And we're always more than happy to talk about any of our priorities in health, early childhood, child welfare. We love to talk, and we love to to
You
build
love to
support.
you love to advocate.
Yes, we love to
Yes.
advocate.
Thanks, Carissa.
Thank you, Tom.